Welcome to another episode of Sesame and Puff. This week, continuing the toxicology theme, we'll talk about the plants and the medications your cat should never lay her paws on, and what you can do to help your cat if you really encounter such situation. Indoor and outdoor plants. Cats are not vegetarians, but sometimes they can munch up veg to increase bowel movements, which is significant if the digestive tract is clotted by fur. While catnip and lemongrass may be a good choice for them, many others can be hazardous to your cat's health, including aloe, hyacinth, mistletoe, tulip, and lily. Lilies in particular is highly toxic to cats, and similar to grapes and raisins, it can cause acute kidney failure. However, while cats are usually not interested in grapes, they seem to like lilies quite a lot. So remember, definitely keep lilies out of your cat's reach. The vet will most likely be treating the cat with forced diuresis, which means forcing her to pee more to pass the toxins out, and giving her a lot of fluids to prevent dehydration. However, once we pass the 3 days window, the prognosis will be grave. Human medicines. There's a list of drugs that can be harmful to your cat, including antidepressants, cold medicines, diet pills, and pain relievers such as acetaminophen, aspirin, and ibuprofen, to name a few. And the list would just go on and on, so my general advice is never give medication to your cat without the vet's instruction, because even for the safest drug in the world, if we give the dose too high or too frequently, it may lead to drastic outcomes. If your cat's been poisoned, every moment matters if you think your cat is exposed to something toxic. First of all, calm down and call your vet. Secondly, try to collect samples. Take samples of the vomit, stool, and the poison your cat ate to the vet with your cat. Thirdly, watch for symptoms. Usually the symptoms of food poisoning are pretty acute, like you can see the signs quite shortly after your cat is poisoned, but some other signs may take a while to show. Here is a list of symptoms to look out for: breathing problems, confusion, coughing, depression, diarrhea. You may also see your cat drinking more or urinating more. Some of the signs include upset stomach, hypersalivation, which means salivating a lot, seizures, shivering, skin irritation, tremors, vomiting, and weakness. Depending on what the cat has eaten, the vet will try to decontaminate the cat by inducing vomiting and giving her the supportive care that's necessary. In general, your vet will try to inject xylazine into the cat's blood vessel, which works on the brain, and induce vomiting from there. Activated charcoal may also be given in powder form directly into the stomach or in tablet form. The cat may also receive IV fluids and furosemides to speed up the toxin elimination from blood by peeing more frequently. Note that vomiting will not solve all food poisoning cases. On the contrary, it may harm the cat even more. One example would be if the cat has eaten some kind of acid, strong alkali, or petroleum product. Another example would be if the cat is in coma. We should never try to make an unconscious or semi-conscious cat vomit. Also, vomiting would be useless if the poison was eaten more than 2 to 3 hours ago, because by that time, the poison was already absorbed and none was left in the stomach for the cat to vomit out. In some cases, the vet may instruct you to induce vomiting at home directly, but never do this without the vet's instruction, because not all food poisoning cases are the same, and doing it wrong may put your cat in a worse position. So that's it for today. Please be reminded that the list I've just mentioned is just the most common things that you will want to avoid for your cat. It's not something that's exclusive or extensive. So if you have any uncertainties on anything, please bring it to your vet and discuss it with him or her. So for next week, we'll have another Sesame and Puff vlog, and the week after that, I'll be talking about cat vomiting, like why cats vomit, and why is it so important. Especially if your cat is vomiting twice per month, then it's definitely a video for you. Even if she or he is not, it might still be a video for you. So yeah, we'll see you in 2 weeks. Bye!